Good afternoon, everybody. I will be speaking about hepatitis and it being the silent killer. So first, let me start by explaining to you where the liver is. The liver is actually at the right side of your upper part of the abdomen, uh, roughly just below, how will I put this to you? Just below your lung. What is the function of the liver? One, it cleans blood. Second, it helps in food digestion and processing nutrients. And thirdly, it helps in fighting infections. So what is hepatitis? Hepatitis means inflammation of the liver. Hepa means liver, itis means inflammation. So you will find in medical terms a lot of the word itis, which means inflammation of the stomach, inflammation of the colon. So in the liver, it's called hepatitis. So if you look at this diagram, this is a diagram of a healthy liver. And this is what an inflamed liver looks like. So why is it a silent killer? Because from a normal liver, it can become chronic hepatitis. It can become cirrhosis. Cirrhosis is where the liver becomes irregular, and it can become liver cancer. And this is where people do not know from one point to another, and they suddenly progress and become a person with liver cancer. So what are the signs and symptoms? What do you feel when you get hepatitis? You'll be surprised, it's like any flu. So you get fever, flu-like symptoms, cough, running nose. You can get muscle and joint pains. You will feel tired. You may have a loss of appetite. You may lose weight. Some people have nausea and vomiting. When this starts happening, they tend to come to the hospital. In severe hepatitis, you get jaundice. What is jaundice? Is yellow skin and eyes. Now, if you look at this patient, this is normal, and next to him is a jaundiced patient. Now, jaundice means yellow eyes with yellow skin. Just yellow skin can be due to beta hypercarotenemia, which basically is too much vitamin A. Some people eat too much papayas and they actually get yellow skin, but the eyes are not yellow. Another sign is dark urine. Sometimes when I see a patient, I ask them, do you have TO-like urine? So if you look at a normal urine, this is normal urine. This is a dark urine, or in a different diagram. This suggests that the liver is swollen and inflamed. Now, this is a bad sign. When you have a pale stool, that means the liver is not producing bile, and the stool becomes white because there's no more coloring from the bile. And furthermore, when they get itchiness and confusion, this means they actually have gone to almost cirrhosis or liver failure. And bleeding can be one of the side effects due to the fact that the liver cannot produce blood clotting vitamins. And okay, so what are the various causes of hepatitis? The commonest cause is viral hepatitis. Then there is another condition which is called fatty liver, which is becoming a problem now, or non-alcoholic steatotic hepatitis. Other causes are alcohol, drugs like anti-cancer treatment, herbal medicine. Now, there are many patients who have been taking traditional medicine and come to see me, and they have liver inflammation or hepatitis. So this is becoming a common problem. Toxicity like poisons, aflatoxin, this is from mushrooms, can also cause liver failure or liver inflammation. Autoimmune means your body produces antibodies towards liver cells, and this can cause hepatitis. Primary biliary cirrhosis is where the bile duct is inflamed and becomes thin or becomes strictured. And then there's another condition called Wilson's disease, which is a copper problem where there's too much copper in the body, and hemochromatosis where there's too much iron in the body. These are all very rare. So let me go on to viral hepatitis. Now, in the world, viral hepatitis causes acute and chronic liver disease and leads to death in almost 1.5 million people every year. Now, to put you in perspective, HIV causes 1.3 million people to die every year. So there are a few types of hepatitis, which is hepatitis A, hepatitis B, hepatitis C, hepatitis D or Delta. This is not your coronavirus Delta variant. Right? This is hepatitis D, then hepatitis E, And there are other viruses like dengue, herpes, and CMV, cytomegalovirus. So let me go to hepatitis A. How is it transmitted? Is by consuming food and drink contaminated by the hepatitis A virus. Commonly orofecal. What does orofecal mean? It means food is contaminated by fecal matter. And this is commonly found with raw shellfish and sometimes close contact with an infected person with hepatitis A. Hepatitis A is usually mild and self-limiting, and the diagnosis is by blood hepatitis A virus IgM. But 20% require admission due to vomiting, they become jaundiced, fever, and they have lethargy. I think one of the highest liver enzymes I've seen with hepatitis A is about 8,000. Just by giving drip and resting the patient, recovered uneventfully. But it took about 3 months for the liver to become normal. Now, less than 1% die from hepatitis A. It is preventable by getting vaccination, and generally there is no chronic sequelae, but it can cause acute liver failure. That's where the 1% of people die from. Now, let me go to hepatitis B. This is a serious problem in our country. Approximately 3 million people worldwide have this disease, and 5% of the population in Malaysia have hepatitis B. In 2010, 2.26 per 100,000 people had hepatitis B. Sorry. In 2015, 12.65. So this is almost 6 times the number it has increased. And 45 to 50% are in the age group of 20 to 40 years old. And males are more than female. How do you diagnose hepatitis B? The doctor will do a blood test, that is by doing a liver function. We do a hepatitis B surface antigen and hepatitis B surface antibody. Now, if your surface antigen is positive, you are a carrier. The doctor will proceed to do a hepatitis B and E antigen and E antibody, and we will do a DNA if your liver enzymes are high. That means your liver is swollen. How is hepatitis B transmitted? The commonest in Asia is mother to child. This is vertical transmission. So if the mother is positive, there is a chance of the child getting it from the mom. However, today there are ways to prevent this from happening. So the other way of transmission is contact with bodily fluids like saliva, blood, and semen, sharing a razor, sharing toothbrush. Okay. And then exposure to contaminated needles, acupuncture, tattoos, syringes, and certain medical equipment. IV drug abuse and needle sharing. So this can also cause the virus to be transmitted from person to person, because when they inject themselves, they take out some blood to see whether they are in the vein, then they inject another person. Blood transfusion is another way where hepatitis B is transmitted, but this is almost reduced to 0 now because we have screening of the blood. Dialysis also almost doesn't happen, but can still rarely occur. And organ transplantation. Nowadays, there's more and more organ transplantation, and sometimes the patient is a hepatitis B patient who is donating the blood, the organ, like in China and India where kidneys are transplanted. So sometimes you can get hepatitis B. So in the acute phase, this is the initial exposure. Patients can be sick, like just like hepatitis A, fever, lethargy, vomiting, diarrhea, and then they recover. But if it becomes chronic is when the virus remains in the blood for more than 6 months. Then you become hepatitis B surface antigen positive. The younger the person is exposed to hepatitis B, the more likely to develop chronic hepatitis B. Now, it is found that if you get hepatitis B when you're 25, 30, less chance of you getting chronic hepatitis B. But the younger patients tend to get liver cancer, and this is where we are trying to prevent it from happening. So chronic hepatitis B will become liver cirrhosis. 25% of those with chronic hepatitis B end up liver cirrhosis and or cancer. And 60 to 80% of primary liver cancer worldwide is caused by chronic hepatitis B. So you get liver cirrhosis, a person can become suffer from liver cancer, or will go to liver failure due to liver cancer, or can have the whole sequence. That means chronic hepatitis B from to liver cirrhosis to liver failure to liver cancer. It is preventable by vaccination. All children are given hepatitis B vaccination at birth, except the anti-vaxxers. This is mandatory by government. It is given at birth, 1 month, and at 6 months. Now, how are we preventing mothers from transmitting to babies? The babies are given immunoglobulins to mothers who are infected with hepatitis B. A very good example was in 1984 in Taiwan. A vaccination program was started, and this reduced the annual incidence of hepatocellular carcinoma or liver cancer in 6 to 14-year-old patients from 0.7 to 0.57 to 0.36 per 100,000 children between 1990 and 1994. So it showed that vaccination reduced the incidence of liver cancer in children, because Taiwan had a very high rate of liver cancer in children. What are the treatment modalities available? There is oral and there's injection. Now, in oral tablets, the current medication used is entacavir and tenofovir, or you may know it as baraclud and tenof. Currently, these are the ones that are using in Malaysia. We used to have lamivudine, telbivudine, and adifovir, but at the moment they have gone out of vogue. And the aim is to seroconvert from hepatitis B E antigen to hepatitis B E antibody, and sometimes to clear the virus. That means you are no more a carrier. It means your hepatitis B surface antigen is negative. The other modality of treatment is injections. Now, injections is a finite period of time. You're given for 12 months. Tablets can be indefinite. So this is where the problem is with hepatitis B. There is no cure at the moment. It is control of the viral load and seroconversion, where we try to reduce the chance of you getting to liver cancer. Now let me talk about hepatitis C. 3% of the world population are infected with hepatitis C. In Malaysia, 2 to 2.5% of population are infected. And even in hepatitis C, there has been an increase in incidence from 2.56 per 100,000 in 2010 to 6.91 in 2015 per 100,000 people. And 50% of the patients are aged 26 to 45 years old. Now, unlike hepatitis B, there are 6 genotypes of hepatitis C. 4 of them are found in Malaysia commonly. Genotype 1, 2, 3, and 4. 5 and 6 is not so common. And the diagnosis again is through the blood. First, a liver function test and anti-hepatitis C antibody is done. If your anti-HCV is positive, an RNA is done. This is to establish the actual absolute amount of hepatitis C virus in the blood. If you have the RNA and it's positive, then a genotyping is done, because the treatment in those days depended on the genotype, which means which type of hepatitis C you had, 1, 2, 3, 4, or 5, or 6. So again, transmission of hepatitis C commonly was intravenous drug use, where people injected heroin and they shed the needles. And then it became solid organ transplantation from infected donors. Same like hepatitis B, but it's more common with hepatitis C. Other transmission modalities were blood transfusion. Also now, there is a lot of screening, so hardly ever happens. Hemodialysis, unsafe medical practices. Now, when I say this, this is not happening now. Maybe about 25 years ago, needles were sterilized and reused. Nowadays, everything is disposable, so you will not see this. And then occupational exposure to infected blood. So this happens to medical people, to the people who dispose of medical waste. Sometimes needles are inadvertently put into the dustbin and then they poke themselves. Another way is birth to an infected mother. This is where, again, vertical transmission, just like hepatitis B. And then also those who have multiple heterosexual partners or high-risk sexual practices. So what is the natural history of hepatitis C? From a healthy liver, you get infected with hepatitis C, you get acute infection. Now, only 20% will show symptoms, but 80% will not have any symptoms and they can go off to have chronic infection. Now, 20% of people will cure themselves, but 80% do not. And that's where the problem is. And then from them, they get chronic hepatitis, and 20 to 30% will progress to cirrhosis. And up to 4% will get liver cancer every year. Now, sadly, for hepatitis C, there is no vaccine available. And there is treatment. And the initial treatment used to be injections with PEG interferon with ribavirin, which is a tablet. And this only gave up to 55% cure. And it was very expensive. The side effects were a lot: fever, hallucinations, mood disturbances, thyroid abnormalities. People got anemia, that means lack of blood. Platelet levels dropped. They had bleeding problems. So this needed very close monitoring. Excuse me. However, there is a new treatment. It gives you 90 to 99% cure. It was most effective for genotype 1 and 4, 96 to 99% cure with this particular type of medication, Vicara-PEG. And then for genotype 2 and 3, these are the types of hepatitis C which is found in Malaysia, Harvoni, and both were only for 12 weeks. So with 12 weeks treatment, you could be cured of hepatitis C. And when it first came out, the companies were giving a full refund if you were not cured. Unfortunately, the cost was prohibitive. It was 250 to 300,000. And not many people could afford. Then the government came up with a hepatitis C treatment program, which is a boon for all people with hepatitis C. And the latest one in the market is Sofosbuvir and Ravidasvir, which for 3 months therapy, you get 97% cure. The good thing about it is broad spectrum. You don't have to know which genotype you are. The treatment's the same. Ringgit, Malaysia, $500 a month. And it's only available at government hospitals currently. Private, we are not given this privilege because the government has invoked a clause for the copyright. And these companies have reduced their drug price to 30,000 to 40,000. So it's still more expensive than getting treatment at the government hospital. Another virus is hepatitis D. This is called Delta virus. It is also transmitted through blood, and the same as hepatitis B, but you must be a hepatitis B carrier to get infected by the Delta virus. It is very rare, and the treatment is again PEG interferon. There is no other treatment, but not many cases have I seen or are there in this country at the moment. Lastly is hepatitis E. This is orophycal transmission, same like hepatitis A. Usually contaminated water, undercooked shellfish is where you get it. It's self-limiting, and there's no known chronic after effects. So that is wrapping up the hepatitis, viral hepatitis. Now let me talk about fatty liver or non-alcoholic steatohepatitis. So this is inflammation and damage of the liver due to fat buildup in liver cells. It is present in 94% of obese patients and 67% of overweight patients. So this is a lifestyle disease. The classification is very clear. Patients must not drink alcohol. If they drink alcohol, it's no more NASH. Now, 25% it is found in 25% of people in normal weight and 40 to 70% of people with diabetes. So diabetes is another problem which contributes to fatty liver. And worldwide at the moment, it is about 20% of patients have it, and it's becoming higher and higher. Unfortunately, it can lead to cirrhosis. And anybody who has cirrhosis has a higher chance of getting liver cancer. So this is something that we need to address because a lot of our young people are obese. In fact, Malaysia is supposed to be the country with the highest obesity rates in Southeast Asia, and we are getting a lot of fatty liver. So what are the stages? From a healthy liver, you get fatty liver. This is deposits of fat leading to liver enlargement. Then you get fibrosis. So we need to prevent prevent fatty liver from becoming liver fibrosis. And after scar tissue forms, you get cirrhosis, which is nodules in the liver, and eventually it destroys the whole liver. Now, when you have early fibrosis, it can be reversed to fatty liver. It can be reversed to healthy liver. But when you have advanced fibrosis, it's very difficult for it to be treated. So this is what a healthy liver looks like. This is what a fatty liver looks like. For those people who eat this atas food, foie gras, that is goose fatty liver. This is what it actually looks like. Maybe after this, you all will stop eating it. I do not know. But if you look at the cells, this is a normal liver cell. Look at the fat lobules within the liver cells. So that's what fatty liver is. Diagnosis again is through the blood. Liver function, we do cholesterols and triglycerides, glucose. Ultrasound liver, this is where we can, initial test, which is non-invasive, where you can actually, the radiologist will diagnose that you have fatty liver. Once you get this, we treat you. If the thing, your blood test does not improve and you do, we find that your liver enzymes are still high, you can do a fibroscan. Now, fibroscan is the new modality where you can see the level of fibrosis in the liver. And this will guide the doctor as to how aggressive to treat you. In some countries, they use CT scan and MRI. We do not do that in Malaysia. And in the early days, the only modality of diagnosing fatty liver is liver biopsy. However, this is a last choice treatment now, last choice investigation, because liver biopsy is invasive. We poke your liver, we take a small sample, and we send it for analysis. But during the process, sometimes you can bleed in the liver. And that's something we're trying to avoid nowadays. And patients were very scared, so we ended up not doing any. So the fibroscan has replaced the liver biopsy now in 98% of the cases. So what are the risk factors? Again, the same: obesity, BMI more than 25 is already a risk factor. Above 30, you're most likely to have fatty liver. Insulin resistance and type 2 diabetes. So this is where we check for sugars, high cholesterol, high triglycerides. Metabolic syndrome. Metabolic syndrome is obesity, high sugars, not diabetes, but pre-diabetes, where your sugar is between 5.5 to 6.1. People with high cholesterol and high triglycerides. This is again becoming an issue because our young people are becoming obese and they are not exercising, eating all sorts of food, and this is leading to non-alcoholic steatotic hepatitis. So this is the diagnosis of metabolic syndrome. Central obesity for the Asian male, a waist more than 90 cm, for the female more than 80 cm. Triglyceride more than 1.7, or if they're on treatment. HDL less than 1.03 for men, women less than 1.29. Blood pressure more than 140 for the upper limit and more than 90 for the lower limit, or if they're on treatment for hypertension. Sugars more than 5.6, or you're diabetic. So what is the treatment? Aim is to lose weight. We would like the patient to reduce between 3 to 10% of their weight. Exercise, control and treat diabetes. This one is where we are aggressive and we treat you until we can bring your HbA1c, that is the 3-month control for diabetes, to below 6.4. We want to reduce the cholesterol because cholesterol is one of the factors that bring down, which cause fatty liver. Supplements, Silmarin, what commercially available is Legalon, Leaf 52, and high-dose vitamin B, Essential Effort is one of those. High-dose vitamin E is also used. This one, very high dose, can only be used for 3 to 6 months because it can cause cardiac issues. So normally, doctor will give you for short term. Omega-3 is another one that is also question mark whether it's helpful. In some patients who don't have diabetes, we use diabetic medicine like metformin or glucophage, which helps with the insulin resistance, or pioglitazone, another medicine which is also helpful. But this is normally after you see a specialist. So what is cirrhosis? Cirrhosis is irreversible damage to the function or structure of the liver. And about 25 to 30% of patients with chronic hepatitis will progress to cirrhosis. Now, the mortality, that means people with cirrhosis, 30 to 60% will die within 10 years. But once the complications set in, a patient can die within 1 year. And it's a severe disruption in the quality of life. So in cirrhosis, you get poor appetite, bloating, nausea, vomiting, change in bowel habits, you can get stomach pain, you can have vomiting blood, you can have gynecomastia, which is breast formation in the male, impotence, jaundice, itchiness, lack of blood, low platelets, low white cells, the spleen can be big, Your potassium can be low, sodium can be low, lack of protein. You become swollen, ascites, that means swollen in the abdomen or in your legs, and get confused as well. So this is a healthy liver, and when it becomes cirrhotic, this is what happens. This is what it looks like. And this is what ascites looks like. And this is another form, and if you see somebody with very red palms, it's palmar erythema. It can be normal, but if they have the abdomen that's swollen, and this, they may have cirrhosis. Finally, coming to liver cancer. So this is the 5th most common cancer in the world, and 3rd most common cause of cancer death. And one of the cancers that seems to be increasing in frequency worldwide. In Malaysia, 90% of liver cancer is associated with hepatitis B, and also hepatitis C, which is also increasing in frequency. So the problem here, why I say silent killer, is patients with hepatitis B and hepatitis C can suffer from cancer and come as the first presentation to the doctor. In the last 4 months, I've seen 2 patients, both hepatitis B, coming in with abdominal pain, and it turned out that they actually had liver cancer. When I examined them, I was a bit suspicious because I could feel a growth in the liver area, and a CT scan proved that they both had hepatitis B, liver cancer, and a blood test confirmed that it was hepatitis B. So unfortunately, they were quite advanced and were referred to oncologists. So first presentation, they never had any symptoms before. So this is why it's very important for people to check for this hepatitis B and hepatitis C. So what's the prevention? Early treatment of hepatitis, while it is reversible, is the most effective way to prevent development and progress of cirrhosis. And please remember, hepatitis B and C cannot be transmitted by hugging, sharing food, coughing and sneezing, or shaking hands or sitting on a toilet seat. And hepatitis B and C can be avoided by not sharing toothbrushes or razors and to avoid contact with contaminated needles. So what's the take-home message? Hepatitis A and B is endemic in Malaysia. That means, it's everywhere. You need to get tested today and tell your family to get tested. And hepatitis A and B can be prevented by vaccination. Now, hepatitis B vaccination is the single most effective preventive strategy in the fight against cirrhosis in our population. For non-alcoholic steatotic hepatitis, you need lifestyle modification. You live healthily, keep the weight to a healthy range, avoid and control alcohol, make healthy choices. You have to choose your health. Enjoying all the time will get you into trouble. So hepatitis has devastating consequences and complications, and hepatitis is treatable and reversible. So please get tested. Please tell your family to get tested. Once you're tested, you'll know whether you need it, and if you do, get vaccinated. We don't want you to come see us like this. Bad news. Thank you and stay safe. How to answer this? Steve Fu. No hepatitis C vaccine. Yes, there is no hepatitis vaccine. Not at any time, and still there is none. UM is giving hepatitis B vaccines. I drink beer with. So, Mr. Lee, the only way to know is to come and see a doctor, do blood test, and do for liver function, and do an ultrasound. If you are drinking alcohol, but if you drink occasionally, you should not have any liver damage from the alcohol. Encik Muhammad Najib, congratulations. Good that you have taken the vaccine. Can hepatitis affect pregnancy? This is from Lucy. Yes, it can. So it depends on what type of hepatitis. If you are a hepatitis B carrier, there is a period of time where we actually will start treatment so that the B virus does not transmit to the baby if you're having active hepatitis B. In hepatitis C, at the moment, there is no treatment. Grace. Hold on, sorry. Elaine Wong has asked me whether there's daily consumption of supplements such as vitamin C and fish oil. At the moment, there's no data to say that it causes hepatitis. Okay, so is there any chance for full cure of hepatitis B or C? Okay, hepatitis B, there is no cure. There is only control of the viral load, control of the serology. Hepatitis C, there is cure. It's with the tablets, as I said earlier. Sofosbuvir and Remdesivir, that is a 3 months cure. Cost that gives you 95 to 99% cure. Now, what happens when a person has taken 3 doses of vaccine but no antibody? So I assume this is hepatitis B. So if you're talking about hepatitis B, you've taken 3 doses, we sometimes offer you a double dose 3 times more. And if it's unsuccessful, you are a non-responder. So then you have to be very careful that you don't get exposed to the hepatitis B. Dr. Heiser, for patients who have had the hepatitis B in childhood and have undetected antibody, I will advise them to take all the 3 doses. Because they've obviously, we do not know whether they had antibodies in the first place after the first 3 doses. And some early KKM vaccinations were not very effective. I do not know why, but I'm seeing some of those patients. So I would advise you to vaccinate the patient with a full 3. And again, if they do not respond, you can give a double dose of 3 doses. And hopefully that's what will get some antibodies out of them. Yes, hepatitis B vaccination can be done at any age. However, I do not insist if my patients are above the age of 60, because hepatitis B, if you get it at that age, is unlikely you're going to get a chronic hepatitis B. But if the patient wishes, yes, we still vaccinate. That was to Dr. Salinder Kaur. Lucy, you have been taking Chinese traditional medicine. Yes, the only way is to take blood for your liver and check. That is the way where you will know whether your liver has any abnormalities or whether you have hepatitis. Believe me, I have seen in this hospital, maybe last year, 2 cases, liver enzymes over 1,000. It was due to Chinese traditional medicine. The minute I stopped, they recovered very well. Hep B carriers are normally not encouraged to be organ donors. Alice Yong. Okay, which one is more important? I will say they are both equally important, Hep A and Hep B, Stephen Fu. I'm not sure about the price. In the hospital, we don't really know the price. But I would advise you to take Hep A and B because hepatitis A is from food, hepatitis B is from blood transfusions. If you happen to go for surgery and you need blood. Now, I didn't mention, but in blood transfusions, there can be a 6-week window period where the virus is not identified by our tests. So rarely, but it can happen that you get infected. So I would advise you to take both. And the blood tests are available in the hospital. Okay, Muhammad Ikram, if you have been infected by hepatitis B in the past, either you're a carrier or you have antibodies. If you're a carrier, you cannot be infected again. If you have antibodies, you won't get infected again. So we need to know which one you are. Encik Nabil, you cannot donate blood if you have hepatitis B. The blood bank will screen and tell you you have hepatitis B and they will reject your blood. Okay, anybody else has any more questions? Have I missed anybody's questions? Okay, Stephen Fu, there is no hepatitis C jab. Which is more important? As I said, Hep A and Hep B, I would say equally important. Different problems, but you know, if you eat outside often, you should get a hepatitis A jab. Hepatitis B is, of course, for prevention of getting a hepatitis B infection. So I don't think your brother had hepatitis C. So I'm not sure what this question is, because the problem with hepatitis A and B mixed jab, my practice, I give the first jab, AB is a combined jab, B is a hepatitis B jab, and at 6 months, is a combined jab. So it depends on the doctor and what vaccine they have. Not everybody carries the Havrix, which is a dual jab. Yes, Grace. How soon can you do a blood test after you take the Hep B vaccine? Normally after 6 months of the last dose. So hepatitis B is at 0, and then 1 month later and 6 months later. So you repeat 1 year from the day of the first dose. That would be enough to give you a booster level, I mean your antibody level. Okay, so I will sign off. Thank you very much. Anything you can contact our marketing people. I think they're going to do some lucky draw, is it? Okay, thank you. Bye-bye.